Hi, I'm Preetisha. I'm integrative nutrition health coach. I say to my client, half battle is over when you know what you are dealing with. So when you know what are the ailment, then in that basis you can give them exactly diet and lifestyle changes to recover out of it. Otherwise, frantically trying various diets and various experiments, it's emotionally and physically draining for the people as well as the family members. So I always insist in finding ailment first, but in case of uncommon or rare ailments, diagnosis becomes really difficult. Celiac is one of the ailment. Today we'll talk about celiac, what are the symptoms, what you should know to diagnose, and how can you make changes in your diet and lifestyle for the celiac disease. Celiac is an autoimmune condition in which our immunity system reacts on consumption of a gluten, which is a protein available in wheat, barley and rye. So on the consumption of gluten, our immunity system starts attacking the healthy cells of our body. It hampers our digestive system. There are 300 plus known systems of celiac disease, so it is difficult to identify it quickly. Apart from this, in long run, it starts affecting small intestine, it hampers the intestinal villi, and it becomes difficult to absorb nutrients for our body. Let's understand various symptoms of celiac disease. First, it hampers digestive system, so it may give digestive discomfort like stomach cramp, acid reflux, heartburn, constipation, diarrhea, gas, bloating, nausea, vomiting, even loss of appetite can also be seen in patients with celiac disease. Malabsorption of calcium leads to lower bone density and it also damages tooth enamel. So risk of fracture increases, it damages the teeth simultaneously. It also affects our nervous system. So vertigo, depression, anxiety, that kind of symptoms can be seen in the patients. It affects on overall body. Malnutrition overall affects in lower vitamin deficiency, including iron, vitamin D and other vitamin deficiencies. One would feel a lack of energy or fatigue. Even infertility, miscarriages are also a symptom of celiac ailment. Since there are many symptoms of celiac disease, diagnosis becomes very important. As celiac disease is extremely difficult to diagnose, there are three ways to diagnose celiac disease. One is allergy test. In your blood work, if the person is not on gluten-free diet, or in other words, if the person is consuming diet with gluten, then this test will come positive. Celiac disease damages the lining of intestine. So endoscopy and biopsy of intestinal villi can diagnose celiac disease. And as it affects bones, so bone density test may also help in diagnosis celiac disease. Celiac disease can happen to anyone including children. Exact causes of celiac disease are unknown. Genes are mostly blamed, it is mostly inherited, but in few cases people get it after pregnancy or extreme stress. To be on celiac diet is the permanent solution for celiac patient. Let's discuss what to be eaten in celiac disease and what to avoid. Removing gluten is the first step in celiac diet. So avoid wheat, barley and rye. Also avoid flours which are having wheat component. Similarly, beer and other drinks in which there is a wheat component needs to be avoided totally. Next is let's discuss what to be eaten in celiac disease. So grains like rice, corn, oats, quinoa, amaranth, ragi, nachni, buckwheat and soy can be eaten. Similarly, various lentils, legumes, pulses, nuts and seeds can also be eaten. However, just consider the possibility of contamination with wheat gluten, as such products are usually produced in a factory that could also make wheat products. So in such cases, reading a label should help. Also check flare-ups after eating a particular brand of a food product. Since it is not advisable to consume wheat flour, consume flours made from starches like potato, almond, chickpeas, pulses, soy, etc. Apart from that, all vegetables, all fruits can be eaten. Meat, fish, chicken, turkey, eggs can be eaten. In liquid, buttermilk, green tea, coffee can be eaten. In case of celiac patients, usually inflammation is higher and dairy might react with them. So in case if dairy is not suitable, then avoid dairy totally. This sounds simple when you talk about celiac diet that avoid wheat, but it is not as simple as it sounds. We have to be careful where the gluten is hidden, and especially in the case of contamination. Contamination happen in especially restaurant or while eating out where food is made with wheat products as well with the gluten-free products. So in that case, wheat definitely mixes up, and that small amount can also create a trouble in celiac patients. The most important is to check where the gluten is hidden. Few examples are like processed junk food like potato chips, wafers, french fries, ready to eat soup, gravy, stock cereal, rice mixes, salad dressing, seasoning, sauces, syrups. Similarly, avoid emulsifier, dextrin, artificial caramel color, mono and diglycerides, preservatives, stabilizers, as they may also contain gluten. Apart from this, surprisingly few medicines, herbal preparations, probiotics can also contain wheat products. So ask your doctor to recommend certain product carefully. You can also ask your doctor to recommend calcium, vitamin D and iron supplements, as usually celiac patients are low on those vitamins. Celiac is a lifelong ailment and one should learn how to live with celiac. We understand that wheat products are needs to be avoided, but the more challenging part is to find where the wheat is hidden. So keep a food diary, keep checking flare-ups, keep checking which food and which brand usually gives you flare-up, and that's how you can keep on experimenting and keep on learning what is suiting to your body. I'm sure it is easy to figure it out once you start walking on the same path. I hope that helps. Thank you.